Hey everyone, I got schizoid personality disorder. Sadly, that this is all we have. We have to record because we can't be in class together, and I wish I could be in class with you guys, but this will have to do. So I got schizoid personality disorder. There's a lot to talk about, so I might as well just jump right into it. This is my table of contents, basically what I'll be talking about. First, I'll be talking about the overview of schizoid personality disorder, what it is, the basics. Second, I'll be talking about the causes. And then third, I'll be talking about the common misconceptions. Fourth, I'll be talking about the symptoms. And lastly, I'll be talking about the treatment of it. And I also added a diagram at the end, but you guys will see that. The sources I have, or I used, are Psychology Today, Mayo Clinic, and the Recovery Village. This is actually all I needed because these sources were actually really useful, so if you guys want to look those up, you can. But let's just get started. So what is schizoid personality disorder? That's what you might be asking. That's what I asked when I first saw that I was assigned to it. I didn't know what it was, but I learned a lot about it through this. So basically, schizoid personality disorder is an uncommon condition in which people avoid social activities and always shy away from interactions with others. They have a limited range of emotional expression. People with this disorder are able to function in their day-to-day lives, live normally as anyone else could or should, but they will not develop meaningful relationships with others. Typically, they're known or seen as loners, and they can be very dismissive towards others. It might seem like they don't care either. The causes of this, when I looked it up, actually, it's what causes the development of schizoid personality is actually unknown. No one knows why it happens, it just happens, it's a disorder. But what we do know is that personality is a combination of thoughts, emotions, and behaviors that makes a person who they are. Some roles that play a factor in developing this disorder is a combination of genetic and environmental factors in early childhood. I also found some risk factors that may occur, having a parent or close relative who has a disorder already, or having a parent who seems cold, neglectful, or unresponsive to emotional needs. So, like parenting styles that we learned about this semester, like disengaged, intrusive parenting, parents, those types of parenting. The common misconceptions. So, I found a couple, but I'm going to talk briefly just about it here, and then I'm going to get more in depth with them in the next slides. But people with schizoid personality disorder are seen as mysterious because they express no emotion and keep to themselves. Because of this, there are many myths created about the disorder itself. The first myth I found was that schizoid personality disorder is similar to schizophrenia. The second one I found was people with schizoid personality disorder are violent. The third one was individuals with schizoid personality disorder cannot function normally. And the last myth I found was schizoid personality disorder can be treated with medication. So we're just going to go into the myths now. Myth number one, this is the fact, this is what we know, that schizoid personality is a completely different mental condition than schizophrenia. I know they kind of sound similar, and I also thought they might be like similar, but they're not. They actually have very little in common, and the main difference was being that schizoid personality disorder is not a psychotic disorder, which makes schizophrenia in a completely different diagnosis category. They both do share similar genetic causes and have social withdrawal symptoms, but people with schizoid personality disorders do not lose touch with reality. They don't experience delusions, hallucinations, paranoia as someone would if they had schizophrenia. People with schizoid personality disorder are at risk of developing psychosis and schizophrenia at some point in their lives, so that's the only connection I really found there. That's how they're linked. The second myth would be that violence is actually not a typical characteristic of personality disorder. People tend to believe that this disorder can be dangerous, but it's not characterized by aggressive or violent behavior. People with this disorder actually do not get angry much at all. People with this disorder, they also experience flat emotions, so same emotion every day, no highs, no lows. People with disorder hardly ever seek treatment, so it makes the disorder unavailable for study, which makes the research very hard and sparse. There's no convincing evidence that people with this disorder are inclined toward violent behavior, and if violence does occur, it's usually related to some mental health disorder they had, like depression or anxiety or any of those. Myth number 3 is, this is the fact, many people with schizoid personality disorder are able to function well and can work and support themselves. Schizoid personality disorder is associated with higher functioning disorders compared to others. The functional impairments of people with this condition is their reclusiveness, so like how they want to be alone, and detachment from life. They often view themselves as observers of life rather than participants. The jobs they work may involve little or no social contact, and they suffer unbearable and inescapable loneliness. Their ability to function depends on if they have any co-occurring mental disorders. An example could be depression, because it's common with this condition or disorder. The last myth is that schizoid personality disorder is not treatable with medication. People with this disorder lack insight of their condition due to the loner characteristics and living their life in solitary. This personality disorder treatment has not been studied well, like I've mentioned before. Although schizoid and other personality disorders cannot be treated with medication, their mental health conditions usually can be medicated. Now we're talking about the symptoms that you will see if someone has it, or to know if you have it. I mean, obviously you can't diagnose yourself, but there are many symptoms that can show schizoid personality disorder. Here's a few of them that I found. So people with this disorder do not desire or enjoy close relationships, and they appear to be detached, like I've mentioned a couple times, but that's the main one. They have little or no interest to sexual experiences, and they feel as if they cannot experience pleasure. They have difficulty expressing their emotions, and they do not know how to react appropriately to situations. They can often be seen as humorless, indifferent, or emotionally cold. They lack motivation and goals. They also do not react to praise or critical remarks from others, and they take pleasure in few, if any, activities and exhibit little observable mood changes. The treatment that I found for this is people with schizoid personality disorders tend to believe that there is nothing wrong with them. That's where they lack insight, and because of that, people usually don't seek help or gain treatment. There is no cure, but there are treatments to help people manage this disorder. Schizoid personality disorder is not caused by chemical imbalances in the brain, so medication typically is not used for this. The only time medication is involved is for the depressive symptoms, which then they would be medicated or prescribed with antidepressant drugs. Therapy happens to be the most commonly form of treatment for schizoid personality disorder. So I'm going to talk about the types of therapy that they can receive. Types of therapy. So the first one I have is psychotherapy. It's a one-on-one talk, a talk therapy that can help individuals with schizoid personality disorders develop closer relationships by challenging their negative thoughts or beliefs and helping them with their emotional expression. So helping them talk about their feelings, trying to gain their trust, really. The second one would be exposure therapy. This therapy involves slowly adapting the patient to uncomfortable situations. Say if someone with schizoid personality disorder wants to learn coping strategies, then this therapy would actually be really good for them, really effective. This therapy aims to slowly reduce discomfort in social situations, so that would help a lot. Group therapy actually is the last one I added because it may be ineffective for someone with schizoid personality disorder because, like I said, they don't like social interaction with people, so they could feel possibly threatened in a setting that included a group of people. But group therapy is a common treatment for many health disorders and people struggling with addiction, which is often what people with schizoid personality disorders go through. That's a common one. And then this last thing that I added for you guys is just like a table, and it shows abnormal features of this disorder and just talking about it basically. But that's all I have for you guys today. I hope you learned a lot, and it was great teaching you guys. Bye.